Hi, today we're going to talk about blood. Blood is the river and conduit of life. It delivers healing and passes on our characteristics to those we cherish the most. But blood is also fragile, and when it's compromised, the results can be devastating. This story is an example of that. It's the true account of a woman who embodied the word toxic in the most literal sense. And the circumstances surrounding her story are crazy. This is extremely strange. Gloria Ramirez lived in Riverside, California, with her boyfriend Johnny and two children from her previous marriage. She was described as a friend to everyone she met, with a lively and endearing sense of humor. Gloria lived a quiet life, volunteering at her children's schools, cooking, and decorating hair barrettes as a hobby. She grew up in Riverside, one of three children in a tight-knit Mexican-American family. Her father was a car mechanic, her mother a homemaker. Gloria had dropped out of high school and held many jobs over the years, occasionally working in fast food restaurants. Her children's father was a maintenance worker named Angel Arciniega, whom she met at a Riverside swim park in 1978. After their divorce, Gloria moved into a garage apartment at her parents' house with her children Evelyn and Angel Jr. While she was there, she met a man named Johnny Estrada. They fell in love and became engaged to be married. Now, all seemed well with Gloria until late 1993, when she began losing weight and felt sick for a couple of months. When she went to the doctor, she was diagnosed with cervical cancer just 2 weeks before her 31st birthday. In February of 1994, she would learn that the cancer was advanced and had begun spreading into other parts of her body. The cancer was not deemed to be terminal, but Gloria was unemployed at the time and without health insurance, so her battle would be stressful and difficult. Gloria kept her feelings and her medical condition to herself and struggled through her personal hardships in silence. On February 19th at around 8:15 p.m., a 911 operator received a call from Johnny, who reported Gloria had suffered from severe nausea and vomiting all day, which seemed to be getting worse, and he requested an ambulance to take her to the hospital. On the ride to Riverside General Hospital, the paramedics noted an elevated heart rate, abnormal breathing, and a sense of confusion bordering on delusion, which could be attributed to the heightened anxiety she must have been feeling at that point. Upon arriving, Gloria was taken into the ER and immediately placed in a room for diagnosis and treatment. Because of her state, nurses quickly administered sedatives to her, a cocktail of diazepam, midazolam, and lorazepam. Gloria did not react well to the sedatives, and things were about to get worse for her and the attending staff. At this point, Gloria went into shock. A defibrillator was used on her, but it did little to stabilize her condition. At this point, staff began to notice something very peculiar about Gloria. Her skin was described as having an oily film to it, and an odd odor emanated from her mouth that was described by staff as anywhere from garlicky to fruity. An RN named Susan Kane started to draw blood from Gloria's arm, but as soon as the needle pierced her skin, a strong ammonia-like smell coming from the syringe permeated the room. When she showed the syringe to Julie Gorczynski, a medical resident, they both noticed some small crystallized objects in the sample. A few moments after this, Susan lost consciousness and was quickly removed from the room. Immediately afterwards, Julie, who had also handled the syringe, complained of lightheadedness and nausea and excused herself to go and sit at a desk to gather herself, but she soon fainted as well. Almost immediately, respiratory therapist Maureen Walsh began to lose consciousness. Clearly, something bizarre and potentially dangerous was going on here, and it had to be addressed, and quickly. It was decided to evacuate all ER patients to the parking lot, along with most of the emergency room staff. Only a small crew stayed inside in an attempt to stabilize Gloria, but despite their efforts, she began going into cardiac arrest. For more than 45 minutes, CPR and defibrillation was attempted, but to no avail, as Gloria Ramirez was pronounced dead at 8:50 p.m., less than 1 hour after her boyfriend's call to 911. Cause of death was deemed kidney failure related to her cancer, but the questions surrounding her death had just begun. In the relatively short amount of time that the ER staff was exposed to Gloria, 22 of them fell ill, with 5 having to be hospitalized in the days ahead. Taking every precaution, Gloria's body was temporarily placed in a separate room and then later sealed in double plastic bags inside an airtight aluminum container, and a team of specialists wearing hazmat suits conducted a thorough search for hazardous chemicals and pathogens in the emergency room, but none was discovered. Doctors Ana Maria Osorio and Kirsten Waller from the California's Department of Health and Human Services conducted an investigation into the circumstances surrounding Gloria's admission. More than 30 hospital staff members working on the night of her death were interviewed, and it was discovered many of them displayed similar symptoms, including loss of consciousness, shortness of breath, nausea, and muscle spasms. Dr. Osorio and Dr. Walter noted that there were other common symptoms they shared. They had been in close proximity to Gloria, they were mostly women, and their subsequent tests, including blood tests, had come back completely normal. Their findings were at once bizarre and dismissive. They had concluded that all of the affected hospital staff members had suffered from a form of mass hysteria. Obviously, this did not sit well with the attending staff, nor would it appease Gloria's next of kin. Julie Gorczynski in particular took umbrage with the official findings. She clearly did not buy the mass hysteria explanation. She had no prior health issues, but in short order following the incident, she spent 2 weeks in intensive care with breathing problems and subsequently developed hepatitis and a vascular necrosis in her knees. Julie was not going to go quietly. She wanted answers. The Riverside Coroner's Office ordered a complete scientific analysis and contacted the Lawrence Livermore National Laboratory, which primarily deals with nuclear research, to get on board. Patrick M. Grant of the Livermore Forensic Science Center spearheaded the inquiry. They came to the conclusion that Gloria Ramirez had been using a substance called dimethyl sulfoxide, or DMSO, as a pain reliever, most likely to alleviate her cancer side effects. DMSO is typically a gel used as a degreasing solution and sold in hardware stores. According to their analysis, DMSO might explain garlic-like odor emanating from Gloria, as well as explain the oily appearance of her skin. It was theorized that use of DMSO could result in urinary blockage, which could lead to kidney failure, which had been ruled the cause of death. In addition, the DMSO may have made her treatment worse, along with the sedatives and the defibrillation. This might explain her blood crystallizing, and DMSO, being a form of sulfuric acid, might also have caused the symptoms displayed by the medical staff. A different explanation suggests that the DMSO was not toxic, but had started a series of chain reactions, which resulted in poisonous fumes in large numbers. When DMSO with oxygen was given to Gloria, it may have become dimethyl sulfone. When Gloria was hooked up to the ventilator, this DMSO may have oxidized and appeared as crystals in her blood. Dimethyl sulfone, or DMSO2, is relatively harmless, but when combined with an oxygen atom, it becomes dimethyl sulfate, or DMSO4, which is a deadly chemical. If absorbed into the body, it can result in paralysis, organ damage, convulsions, and coma. This is why people stopped using DMSO as a home remedy. But DMSO4 vaporizes at 370 degrees Fahrenheit, not in a typical emergency room. There are records of people being exposed to the gas, but their symptoms took hours to appear, not minutes. Plus, the gas would have needed to somehow completely dissipate and leave no trace for the hazmat team to find. So, these theories are not without dispute, both from the medical and scientific communities, as well as the family of Gloria Ramirez, who steadfastly maintain she never took DMSO for her cancer symptoms. Pathologist Dr. Richard Fukumoto was hired by the family to investigate Gloria's death, and was able to examine her body. Unfortunately, he was unable to determine any alternate cause of death, mainly due to the body's internal organs being cross-contaminated with fecal matter and advanced decomposition. Even more strangely, Gloria's heart was missing at the time of his autopsy. Compounding this, the syringe used to draw her blood couldn't be located, and therefore could not be analyzed, and some of those internal organs went missing. Gloria Ramirez was laid to rest in an unmarked grave at Riverside's Olivewood Memorial Park on April 20th, 1994. During the proceedings, her family maintained the hospital failed to care for her properly, and believes that the hospital is likely to blame for the toxic fumes that took her life. The mystery of Gloria Ramirez's death became the subject of many crime and investigation shows. Grey's Anatomy took inspiration from her death in one episode, and the X-Files mythology, where an alien displays toxic blood, was basically an inspiration from her case. And of course there are the conspiracy theories, with one alleging that some of the staff were running their own meth lab on hospital property and smuggling it out in IV bags. The theory is one of these IV bags somehow ended up mixed in with the IV bags meant to be used on patients, and the ER staff, unaware of this fact, hooked it up to Gloria Ramirez. Meth fumes then seeped into the room where they drew her blood. Other rumors claim the Riverside County and Riverside General Hospital Administration didn't want the bad press and covered the whole thing up. Of course, there's no evidence to support this, but that never stopped anyone from spinning a good story. It should be noted that in 1991, the hospital was cited when 2 employees sought medical treatment after a possible leak of a hazardous gas from a sterilizer. And in 1993, the California Division of OSHA notified Riverside General that the first floor ER was permeated with sewer gas from a drain. In the end, a good mother, friend, and partner lost her life under the most bizarre of circumstances, as if she hadn't had enough thrown at her already. She has been given the title of the Toxic Lady, which is not indicative at all of the life she truly led. But all of this considered, the strange death of Gloria Ramirez will remain in the world of medical science an ongoing mystery.